Good Wednesday morning and happy Veterans Day. I'm Dr. David Wild, Vice President of Performance Improvement here at the University of Kansas Health System, sitting in for Dr. Steve Stites. We're coming to you live from the Dolph Simons Jr. Family Broadcast Studio. Today we celebrate and salute veterans. Here in studio with me is Senior Surgeon and General Surgeon here at the Health System and Major in the Army Medical Corp Dr. John Alley. On Skype, we have Justin Hoover, Veteran and Executive Director of the Battle Within, and also Craig Crumpton, a veteran, firefighter, and member of the Air National Guard. Good morning, gentlemen. Craig is also an alumni of the Battle Within and was just diagnosed with COVID-19 last week, so lots to talk about there. But first, Dana, how did we do overnight?
Yeah, we had a few more admissions, so our total still is pretty high, higher than it has been, and we saw a steep increase. 78 total acute patients in the hospital right now, again, which is quite a departure from the 30-some that we had a week or 10 days ago. 22 of those in the ICU, but 14 of those on the vent, so a very high percentage on the ventilator. We still have 36 in that recovery period, but only 4 of those on the ventilator, luckily. And then in Hays, they are seeing an increase in their numbers too. They have a total of 21, so 19 acute infections, and then 2 in that recovery phase as well. So.
And just to say, we've been in communication with a number of health systems across the metropolitan area and really across the region, state and region, and this trend up is consistent everywhere that we've spoken with. So more on that in a few minutes, but before we get too far down that road, Jill, are there any reporter questions this morning?
Good morning, guys. This is Taylor Hemness from Channel 41. I wanted to check in and ask about these new recommendations from the CDC announced yesterday about mask wearing being a benefit to the wearer as well. Obviously, we've been all about protecting other people for the course of the pandemic, but now we're getting more direction from the CDC about it being good for you too. Is that a big change? Should it already have been considered that? Is it a push to get more people to wear it? If you could comment on that change in directive from CDC.
Yeah, absolutely. That's good. It isn't a big change per se. You know, we've always said here we have gone back to reiterating why we wear the mask as barrier protection. But following that, we've also said, but it does offer the wearer some protection as well, because there are very good publications that can show that. It's not as good as an N95 if we're talking about a cloth face mask. But we've always said that there is evidence that suggests that it does offer the wearer protection as well. So therefore, if you have barrier protection on one person that you're talking to, and then if you have a mask, that decreases the chance of spread as well. So I think it's good that the CDC has come out and showed that, because there are also, for many reasons, there have been holdouts to wearing masks. One of those has been, well, it doesn't protect me. And now we have, our national organization that we look to for guidance saying that it does offer protection. But that is not really necessarily otherwise new data. They may have seen some new data, but there is data out there in the past also to suggest that even cloth masks will offer some beneficial effect for the wearer in protecting against acquisition of the virus as well.
Yeah, I agree. We've said from the beginning that we know that a barrier on a wearer prevents droplets from ending up on your mucous membranes, right? Your mouth or your nose, not necessarily your eyes, which is the reason for eye protection as well and protecting yourself. But nonetheless, we've said that, so this is a good reinforcement. And I cannot believe I'm going to do this, but I'm going to sound like Steve Stites for a minute. I'm going to talk about the cystic fibrosis population. But if we think about populations who have been susceptible to droplet transmission of disease, for a long time, we've known the benefit of a cystic fibrosis patient wearing a mask when they are around other people who could transmit disease to them. The same is true of our bone marrow transplant populations, for example. So again, I agree. This is not new data. It's a reinforcement. It's great that it's out there publicly, that it becomes part of our recommendation from the CDC. But I would agree completely with Dana. This is not necessarily news or something that's a dramatic departure from what we've been saying really for several months now.
Taylor, do you have another question?
I don't think so right now. Thank you.
Thanks, Taylor.
Great. Thanks, Taylor.
Any other reporters on the line? I do have one question here. It's from another reporter, and it is also with the CDC report. I guess apparently on Monday, there was a report that was issued that said 1 in 11 patients that are admitted to a hospital are readmitted 2 weeks and further down the line. They want to know, are we seeing that trend?
So,
You would know the numbers.
Yeah, I can tell you about numbers. So we definitely have seen readmissions. We've seen readmissions as close to 2 or 3 days from the time of discharge and out to several weeks or months. And I think we know that as more and more patients get farther out from their initial infection, we have a better idea of what's happening. So I don't know for sure if I can support or refute the 1 in 11 number off the top of my head, but we have definitely seen this. And I think it is true that there are people who much farther down the line end up needing to be admitted for care of their symptoms. I know, Dana, you've seen some of those people anecdotally. I don't know if you have anything to add.
Yeah, absolutely. And I think this goes back to that bimodal disease that we're talking about, the viral infection, where people just feel bad. They have fevers, they have body aches. They're very tired. They can't do anything. They come to the hospital looking for care. We give them supportive care. They start to feel better after a couple days. And then that is the first part of this bimodal disease process. The second part is that inflammatory state. So then it's like 10, 14 days after your initial symptoms when you have that immune dysregulation, those things that occur maybe within the lungs, maybe with blood clotting, they come back with increased shortness of breath, hard to breathe, not getting enough oxygen, or things of that nature. So that could be part of the bimodal disease. We've seen this from patients who have been admitted to another hospital and got discharged because they were doing well and feeling fine, and then came here. But that road has gone the other way too. There's people who were admitted here, felt well after a couple days, after their first few days of symptoms, and then have gone to another hospital for admission as well because they are doing worse. So that happens. We have seen that here. One of our most publicized and well-known patients, Anil, was hospitalized at least 4 or 5 times for different reasons. So it does happen. I don't know the exact numbers about 1 in 11. Again, the data sets that the CDC looks at are much greater than here anecdotally at our hospital. But yes, it does happen. And that could be a big driver of why it happens, but also even later on in that disease process where you have persistent complications, just as Anil has described in his talks with us.
All right, well, thank you for those. We'll come back to community and reporter questions later on in the update. I did want to share a couple of things before we dive too much into the conversation about Veterans Day and how COVID-19 is impacting our veterans. And the reason I wanted to take a moment is the situation on the ground here in our community and across the Midwest continues to become more and more concerning every day. For 3 or 4 weeks now, I have shared with you an updated version of this picture. This is the population-adjusted average number of new cases per day, the 7-day average by the U.S. Census Bureau region. And you see the Midwest at 729 average new cases per million per day. And no end in sight. That the slope of that line is not getting any better. And the news maybe this week is while that line continues, you see all of the other regions on a sharp uptick now. We continue to talk about the concern related to a number of new cases rapidly increasing. And that does, without a doubt, lead to more hospitalizations. And we are seeing that here in the Kansas City metropolitan area. We are seeing it across Kansas, across Missouri, really across the entire Midwest region. And so we continue to ask each of you to make a difference, to do what you can individually to help us reduce the community spread of disease. Those pillars of infection prevention and control in every setting become more and more important as these numbers climb. We'll be talking much more about this as we begin to see the impact on our healthcare delivery system, which we know has increased, as I mentioned at the onset, in the number of patients in the hospital, really here in the metro area and across the region every day for the past couple of weeks. The next slide is a reminder that we're seeing a very, very similar pattern here in the Kansas City metro. And that if we continue with the theme of hospitalizations following the new case curve, and we know it looks very, very similar, this portends a significant challenge for our area in the next couple of weeks, and that's assuming that we would decrease the number of new cases per day here pretty rapidly, right? We know that hospitalizations follow a week after new cases, and people stay in the hospital, especially those that are critically ill, for 5 to 7 to 14 days. And so we have a pretty rough and rocky road ahead of us. And it's not too often that we sound the alarm and really say, we need your help. We've been sharing that you can control this. Each of us has a role to play, but we're really saying now we need everyone to pay attention. This is different. This is all of the things that we said could happen and that could, if they happened, would scare us in March or April are happening now. A rapid increase in the number of cases, a near exponential growth curve, a replication rate that is growing and rising rapidly, meaning every one person in the metro area now is infecting nearly 1.5 others, between 1 and 2. And that means that we will continue to grow at a rapid rate. There are areas in the Midwest where every one infected person is infecting 3 or 4 others. And we're on our way to that if we don't really do something to change that and really bend the curve again. And we've done it before. As a community, we know we can. So much more on that over the next couple of days as we really understand how quickly this impact is changing what's happening on the ground in our hospitals. But now, I think more importantly, let's get to our Veterans Day conversation. You know, our executive team has benefited greatly from using fun facts every day as a moment of levity in leading and really managing our teams through what has been a bit of a rocky several months. And so maybe I'll transition here with a fun fact about Veterans Day, which I was corrected yesterday by this fun fact. So I had written Veterans Day with an apostrophe. Veterans, S apostrophe, and that is incorrect. Veterans has no apostrophe because it is Veterans Day, I should say, has no apostrophe because it is not possessive to any single veteran or group of veterans. It's a day where we celebrate the service and thank all veterans for their service. And so I was proud actually to be corrected yesterday so that I know now that fun fact and won't make the same mistake again. And so let's move into a little bit of what that means here in our place. So Dr. Alley, first, thank you for your service. Thank you. Welcome this morning. So you're a general surgeon here, and you also have a connection to the Army Medical Corps.
Absolutely. I was calculating this the other night. I'm a 14-year veteran so far. And that means that I spent my first 10 years enlisted. That was prior to medical school. And then, took a very short 17-year hiatus while I went through medical school and residency and got into practice. And then about 4 years ago, I accepted a commission back into the Medical Corps. And presently, not only am I one of the practicing general surgeons here on faculty at KU, but I am also one of the surgeons in the Kansas Guard, and I work directly with the state surgeon of Kansas.
And to be clear, the state surgeon of Kansas is Dr. Lee Norman.
Just happens to be Dr. Lee Norman, who is our secretary of KDHE.
So tell us a bit about how COVID-19 has impacted your patients, and also how it's changed the work you do with Dr. Norman in the Medical Corps. Oh,
absolutely. There are so many stories I would love to be able to tell, but we don't have that kind of time. As far as the way it's changed or manipulated our practice is a little bit different than our medicine colleagues in the fact that as our medical and critical care colleagues start seeing more and more patients of an acuity level requiring ICU care, et cetera, our practice, on the other hand, was trending downward, because our elective practices and things we were turning those down in an effort to shift not only PPE but other equipment, et cetera, to the COVID project. So initially, when we really started seeing that uptick, March, April, we started to see a downturn in our own practices, and that actually opened an amazingly wonderful door for myself, because at that point I actually was able to step away from clinical practice and went on orders with the state and spent a little over a month and a half or so working in conjunction with not only State Incident Command, but also the offices of KDHE. And we were able to help facilitate a number of things, including site surveys for the possibility of expansion of beds. I don't know how many people out there have ever had the opportunity to try and help spend $35 million, but it was a lot of fun as we were looking through and looking for contracting and help in acquiring things as simple as N95 respirator masks all the way up through ventilator systems, et cetera. And it was an opportunity to watch the machinery work that you don't normally get to see. And it was an amazing opportunity, not only to watch the medical community all come together, but to watch the various departments in government come together and actually work in a well-oiled fashion to make things happen. The Guard, both Air and Army, have been just absolutely, utterly amazing throughout all this, even though it's been primarily in the background. Couple of, as Dr. Wild put it, a couple of fun facts. As of November the 2nd, I believe it was, the Kansas Guard has gone through and through all of the COVID, et cetera, has delivered, I believe it's just over 8 million meals.
Wow.
To the area around, all throughout the state of Kansas. We've had teams that have done things similar to that for other states as well. And it's the amazing part that we have so many wonderful employers, KU, but not only that, but all the other employers around the state that have been able to free up our guardsmen and allow us to take those positions. From everything from contact tracing to delivering meals to providing care, especially through the prison system, et cetera.
Pretty incredible stories there. And I think I'll just say all of that work to set up plans that were contingency plans at the time that we hope to never use may very well end up helping us over the next few weeks. So much more to come on that, I'm sure, as well. Justin, good morning. Thank you for your service. Would you like to tell us a little bit about what you would want us to all know about the battle within?
Yeah, sure. Thank you very much for having us back on. So COVID has really impacted our veterans in many ways. The pandemic in some ways has really highlighted what our veteran community has felt for the general populace. There's a lot of hyper-arousal, hyper-vigilance, just the self-isolation that we've all faced to this pandemic. That's really what our veterans have faced, for years. And so for them, it's really just turned the temperature up. Many others like Craig, they'll continue to serve as first responders, corrections officers, Border Patrol, many agencies that have also felt the impact of this pandemic. And so really the temperature has been turned up on everyone. And what we've seen is that they've reached out more and more for mental services. I've been on my own journey for 4 years, and it's been incredible to see how administrations, departments, and military commands have all really worked at supporting their folks now. And so in the last 5 months, 6 months, we've had agencies and departments reach out to us on a record scale, really representing over 50,000 warriors, and they're recognized now that they need to help support their mental health, and they don't know how to do that, so they turn to organizations such as us.
And Craig, good morning to you, and thank you for your service as well.
Morning.
I know you had recently tested positive for COVID-19. How are you feeling today?
Amazing, actually. Yeah, I feel really good. I just kind of turned the corner about 2 days ago, so feeling better. I really only had a fever for about an hour on the first day, and that's what kind of got me to get checked out. And then it's just been body aches and soreness and that whole deal.
I'm glad you're feeling better and been able to manage it without too much trouble at home, it sounds like. I understand you are a first responder as well?
Yes, sir. I work with Independence Fire Department.
Great. And I'm sure in that role you have seen the impacts of COVID-19, both on your fellow first responders and on the community?
Oh, yeah. It's definitely taken a toll, but our administration's made some awesome changes and got us, everything we need and handling it as we can.
Great. Justin, I want to spend some time talking about the battle within and the services offered. Would you like to tell us a bit about what that means, what the organization is, and what you're able to do to help our veterans?
Yeah, sure. So we are really comprised of over 100 veterans, first responders, and community leaders that started this organization, all to help our nation's warriors find their path to healing. And we do that by creating an atmosphere through our services where they can really understand the traumas that they've endured in service to others and develop the integrative skills such as yoga, mindfulness, meditation, nutrition, and many others that really set the stage for healing and allow them to take those skills and tools and adopt them meaningfully back into their daily lives. And then finally, and most importantly, is really develop that community of genuine, authentic support of their fellow warriors, because this is a long journey that really takes that support and that accountability from those that have been through similar experiences such as yourself. So we do that through several different ways. First, our warriors come to Kansas City from around the nation for free, where they go through what we call the Revenant Journey. And that's a 5-day program which really allows people to have those bonds that we've developed over, the course of a war or course of an enlistment, really in 5 days. And it's something where folks get to see each other at their best and their worst and accept each other for all of it. And that's really what community is built out of. It's built out of that trust and those relationships. And then we have other services such as the Frontline Therapy Network, in which we allow folks to continue that journey by matching them with a therapist or a clinician and giving them 6 to 10 free therapy sessions so they can continue that journey. And we've opened that up here in the pandemic to frontline medical personnel, such as the University of Kansas Health System, which was one of the first adopters. We recognize that to going overseas, but it is that work that's done. And, more nurses have been killed in this pandemic than nurses in World War I. So it was something that we really felt the need to provide that to others that are fighting the fight just as we are.
Pretty incredible set of services and stories that you have there. We'll come back to the offer that you've made to healthcare workers in a minute. But first, Craig, Justin tells us you are an alumnus of the Battle Within. Tell us a bit about how you know Justin and about the services that you've received and sort of your journey.
So mine started, I went through Battle Within number 004. That would have been May of 2019. And since then, I've started a mentorship with them. But really, it's just finding a community that I can talk to that will hold me accountable. And again, I hold people accountable, that and trust me with that. And again, just being a part of a community that is going to hold you no matter what you do, no matter what you say, what you're going through. They're there for you. They understand. And it's an unconditional positive regard.
That's incredibly important. So for both of you, Justin, maybe I'll start with you. What words of encouragement or advice might you give veterans who are listening today and struggling for whatever reason during the COVID-19 pandemic?
Yeah, I would say we come from professions where we ask if each other are good. And what I mean by that is like a IED, an improvised explosive device. When that goes off against the vehicle, the dust flies up, and so you can't see, and your eardrums are blown out, and you can't hear. And everyone is reaching out to each other and saying, "Hey, are you good? Are you good?" And what that means is, "Hey, when this ramp goes down, are you going to help us drop some bodies? Because that's what's required." But when we get back to the fob, nobody ever asks, "Are you okay?" And we don't really want to know the answer because our profession is a team sport. And so if you aren't okay, then the first thought that comes to our mind is, well, you might get me killed. So I have a quick solution to this, and that's over there, weird kid. And that shame and isolation slowly kills you. And so it's okay to not be okay. We need to get better at asking that. We need to be better at advocating for ourselves. And especially during this time, during this pandemic, when it is really hard to be in community, we all should be reaching out to each other and checking in and helping people find those resources and find that support before they hit that death spiral of self-isolation and depression and ultimately suicide.
And Craig, I'd ask you the same thing. Words of encouragement or advice for those that might be struggling today?
Really, I don't think there's really any, I can't really give you a cookie cutter answer there, a slogan per se. Really, the words that were given to me or asked of me was, what are you going to do in a 5-day period that's going to better your life? Point blank, the guy just really asked me, or told me, I know if you're anything like me, you've made worse decisions to try and help yourself out. So just take this next step and see where it leads you. And it's been amazing.
Yeah. What are you going to do in 5 days to better your life? That's a pretty powerful question. So, Justin, you mentioned that you and the organization, The Battle Within, have opened up services to frontline healthcare workers, whether that be first responders or medical providers in the hospital or emergency department or clinic setting. Tell us a little bit about what those services are for those who might not be available. I know they're counseling options, but what that might mean and why someone might reach out to The Battle Within rather than, say, their employee assistance program or some other option.
Sure. Well, first off, we've always supported a multitude of professions, such as first responders, corrections officers, dispatchers, ER personnel. Our definition of warrior is basically anyone that doesn't get to say no. And what that does is really allows people to come to understand that you don't have to have the same experiences. Like for myself, I believe that only other veterans could really understand because they had those same experiences as I did. And so they were the only ones that I could really relate to and help me. And that's not true. Trauma is trauma. And so these professions, while diverse, really are all kind of the same. They impact our relationships. They're lifestyles. They're not just jobs. And so being able to come together with others that have similar experiences but not exactly the same helps you understand that this is a human condition. If you put people in a fire, they're going to get burned. Same thing, if you put people in traumatic situations over and over again, they're going to have a traumatic injury. And that impacts your life and it impacts the relationships in your life the same way. And so we really felt it was important to open those services up to frontline medical personnel. And so really what they are able to do now is they're able to sign up for the same things all of our other warriors are. They are able to go to our website, thebattlewithin.org, and they're able to sign up for Revenant Journey classes, which again are those free 5-day classes held here in Kansas City. They're also able to take advantage of the Frontline Therapy Network, which again is really that network that we've created that is vetted clinicians that have the experience and the education to properly support this population. And then we do an interview with the warrior where we match them with a therapist that is best able to fill their needs. And then we provide them with 6 to 10 free therapy sessions. And what we have found is that a lot of our warriors and our medical personnel reach out to this service over their, say, EAP program or what they have offered through work, because you don't go to work to heal, and you want that trusted third-party place where you can really share those deepest, darkest burdens and not have to worry about your career. And that's really what the Battle Within has established. We don't have connections with employers beyond just kind of the agreement that they will allow people to use our services. And so we don't report anything back. And it is that place, as Craig kind of said, where that unconditional positive regard can allow people the space to unburden themselves. And that is so impactful. You just feel like this weight has been lifted off your shoulders, and that allows you to move past the shame that so many of us feel from our traumas and really begin to actually start the healing process.
You know, one more thing before we get to what seems to be a lot of great questions this morning. You know, across the board, it seems like COVID-19 has challenged fundraising efforts for a number of organizations who depend on donations from the community. I'm assuming that at least part of the funding for your work comes in the form of donations. Are you seeing a challenge? And if so, what message would you send to those out there who might be asking, how can they help?
Sure. Yeah. COVID-19 has definitely impacted fundraising for all nonprofits. You know, it's very hard to hold events. I think we are all kind of Zoom fatigued out, and so trying to hold a fundraiser through virtually is challenging. I'll say Kansas City has always been amazing to our Warriors. I am so thankful that I ended up here, and there was that moment where I just felt, beyond people saying thank you for your service in the parking lot when they see my license plate, that's really all they cared. But Kansas City has proved that assumption wrong in a huge way. And so really, if you'd like to support our veterans and first responders and medical personnel, if you go to thebattlewithin.org, there's the opportunity to donate. And we'd be grateful to use that to support our Warriors here in Kansas City.
Well, Jill, why don't we jump in and get to some community questions?
All right, Hugh wants to know, he has friends and family that in mid-October all tested positive for COVID. He wants to have them over for dinner on Thanksgiving, and he wants you to tell him that's okay.
Dana, what would you say to you?
You know, if everybody tested positive, I guess that's fine. You can have a get-together. You know, I think it all depends who did test positive, who is in your bubble, what is the size of that group still is extremely important. I think you still need to try to take as many precautions as possible. Again, we know that reinfections can happen, and we don't really understand exactly what will happen if you get reinfected. You know, will you have less symptoms? Will you have more symptoms? If you're in October, you should have that immunity because it is so close. It's less than 60 days or 90 days from your initial infection. But I don't think, I still think that is the wrong message. We don't want people going out and actively getting infected so that they can start having get-togethers for the holidays, for Christmas, for Thanksgiving. That is not the right things to do. We've always said that even if you have had infection and recovered, you still need to continue to do those public health guidance measures, and that is masking, not meeting in large groups, not going out if you're ill, and distancing as much as possible. You know, we've had other questions come in from the community about wanting to do that, talking about we're going to space these groups out in these rooms. I think you need to continue in the context of your get-together to continue to do those public health measures.
Yeah, I would just say, regardless of the specific circumstances, treat everyone like they could be positive as you interact with them. And the very specific reason in this question is that we don't know for sure at what point you could become a carrier after an acute infection. So while I agree with Dana, it's very likely that there's immunity that would prevent you from actively becoming reinfected. We don't know that you couldn't spread to someone else virus even if it's not actively infecting you. It's probably not likely, but the reality is we don't know. And so treat everyone like they were positive. Keep your bubble small. I'd recommend that we not go down the path of having gatherings simply because some or all have tested positive at some point in the past.
Donna adds that the CDC is now recommending that people celebrate Thanksgiving only with the people in their bubble. Do you agree?
Yeah, I mean, that is there. So as we've moved through this, we have seen that there's optimal public health guidance and protections and measures to take, and then we understand that there is reality. We really promote what is optimal. It is up to you, as Dr. Stites had said, risk reward benefit, to understand what are those risks and what is the true benefit of what you want to do, but in the context of what is the optimal measures to take, and that's these non-pharmaceutical measures of masking, distancing. So optimally, the CDC is saying that because we know that there is so much spread out in the community, out around the nation, out in our local community as well. So certainly I would agree with that.
All right. Matthew says, I may be late to the party, but what do you consider to be the most important series of data to share with the general public? The incident rates, the positivity rates, they're asking if there's more that we should be sharing.
So the most important data to share with the public in general. That's a bit of a hard question.
That's what you had on your...
Yeah, I think it is what we shared today. Number one, that we know and can continue to show over and over and over that hospitalizations follow new cases. And we see a rapid increase in the number of new cases. And that means we have to expect that in the next couple of weeks, we are going to see a rapid increase in hospitalizations. So I would say at this point, it's those two pieces. We know that hospitalizations follow cases. And if cases increase, we have to be prepared for the same or resultant increase in hospitalizations at a time where hospital beds are tight. And so I think that's the most pertinent general message.
Sandy wants to know, would it help to flatten the curve if we were to go back to only allowing carry-out sales of bar goods and restaurants?
So that's a question better answered, I think, by our public health office epidemiologists. They know the specific examples of where transmission can be traced to. I think what we would say is, in general, any place where people congregate, especially if they're not wearing masks, which tends to be the case in restaurants, whether you're indoors or out, are opportunities for transmission. And if people aren't doing those things for whatever reason, the opportunity for disease spread would decrease. So short of creating a recommendation for policy, that's really the role and responsibility of our elected officials and our public health officers. I would say, it seems reasonable that would be an intervention that could help. The rules of infection prevention, those pillars apply in every circumstance, restaurants or not. So
yeah, and we know that the CDC has recently put out, I think late last night or today, information that gyms, restaurants are the places where people spread. Again, we go back to what is the optimal public health and medical guidance and recommendations, and what is the reality. We understand that people need to work. We need everybody to put food on their table and be able to bring home a paycheck. But taking that into context of all these other details of optimal public health guidance, keeping the economy going, keeping people in work, we can tell you what the optimal medical and public health guidance is, and it, just as David said, it's up to the elected officials and the public health officials to make those kinds of decisions.
Margaret has questions about the demographics of the people that are being hospitalized now. Do they have comorbidities? Are they older?
So those values vary really from week to week in aggregate. We've shared that over the summer, for example, the average age of those being hospitalized was decreasing. That has stabilized now. We remain in the 50s, maybe low 60s, depending on the week for the average age of hospitalizations. And overall, still a significant number, or not insignificant number, maybe 10 to 20% on any given week have no comorbid conditions. So some weeks that's 10, some weeks it's 25%, but we're in that range. So, right, somewhere around 1 in 5 to 1 in 7, I think it's safe to say, really don't have comorbid conditions, no coexisting disease. And that, I think, is just a reminder that, right, we have seen patients of all ages and patients who are completely healthy otherwise need to be hospitalized for pretty significant impacts of COVID disease, whether that be, children under 10, high school age athletes, or young adults, all the way, of course, to those that come from long-term care facilities or nursing homes.
All right, Kendra says, most of my chronic illness has the same symptoms as COVID. How can I tell the difference? And by the way, my adult grandson lives with me, and he recently tested positive for COVID.
All right.
You want to start?
Well, there unfortunately there was a very good recent study showing that in the households, I think this was an MMWR report or emerging infectious disease out of the CDC, that showed that really about 50% of people in that household will get infected. We had previously said it's probably 20 to 30%. They did a very good study where they looked actually at swabbing people every day for PCR tests and found that about 50% household attack rate for that one study. So there is a high chance you are probably most at risk of getting that disease probably the first couple days prior to any symptoms occurring to about 5 days afterwards. So there is high risk. It's going to be difficult if you have chronic medical conditions with symptoms, but I think symptoms that you would be looking for are new or increased symptoms over your baseline, but also things like fever, constant aches or change in aches that you have. So just looking at if there are any new symptoms or a change in the baseline. And in the meantime, I would definitely suggest trying to isolate in that household as much as possible, or possibly going to another household or place to live for that 10 days or so if you're able to do that.
And there's no doubt that there are plenty of other diseases, chronic or acute, that have symptoms similar to COVID, and that becomes part of our challenge right now. So I guess I would say the best advice I could give you is if you feel like anything is different, off, increased, or you have a fever, those would be the things that would probably suggest that you should seek medical care.
So this next one may be a contact tracing answer, but Michael wants to know, we keep saying be more vigilant, but when he's out and about in public, he thinks people are wearing masks. So why are we not seeing fewer cases instead of more? Where do we think it's coming from?
Well, there's a decent amount of data that's been shared around where, both at the CDC level and locally, about where transmission is occurring. And I think Dana mentioned there's no doubt restaurants and bars and gyms have popped up at the national level. We've seen that locally here. We've also seen in a number of circumstances family gatherings. Whether they be, and I shouldn't say family, gatherings in homes, right, of 10 or 20 or 30 or 40 people. So increasing the size of your bubble. Now, mask wearing in general out in the public probably is better than it was a few months ago in many areas. And that undoubtedly has helped. But there are a lot of other circumstances where people are interacting now, whether that be their gym or a restaurant or a bar or in their home. And those are the interactions that I think we're most concerned about being the source of most of the spread.
Right.
Okay,
One more question. Okay, I'm going to give this one to Michael. I love it. It's right on topic too. He says, and I just lost it. Hold on, Michael. My phone. There it is. I have a friend who is a World War II veteran and has been in a nursing home and has been in lockdown since March. How can we best say thanks to those who are least able to hear it?
Dr. Ali, I'll start with you, and then we'll let all of our guests answer that question.
You know, fortunately or unfortunately, we are in an era where we actually have a lot more technology. Unlike in days past, where if you were in lockdown, there was no way to contact, we at least have telephone and things where we can attempt to make contact. And, you know, I think probably the most important thing is it's, you know the old saying, it's not the gift, it's the thought. And I think that there's a lot of value in that you are reaching out in whatever manner you can and letting that person know you are not forgotten. You are still here. We still know you're there.
Yeah.
Justin, thoughts?
Yeah, I would definitely echo that, reaching out and having that connection. I would also suggest letter writing. It was one of the things that even recently during our deployments that a lot of folks wrote home, and it definitely shows the thought, because it takes that time, and it's something tangible that they can go back to. And so really just reaching out as many ways as you can.
Craig?
I'd also say lean on technology. A good FaceTime session with the grandkids is always good for the soul. So lean on that, and you'll have a lot more benefit than you think.
Dana, I'd say early on in the pandemic, we were really worried about the potential for transmission on inanimate objects and the movement of things into or out of places like long-term care facilities. And while there have been a lot of studies that show that that's still possible, I think clinically we've not seen a lot of concern about that being a source of transmission.
Correct.
And given that, I think there are probably a number of creative ways that people can share things. Letters are a great example, but probably other ways that things could make it in as gifts to thank people in veterans in exactly the situation described. Is there anything that you would say is definitely off limits in that regard?
I don't think so. Again, just as you said, it's that close personal interaction. So, either doing it out the window or sending those care baskets, those gifts, those letters, I think is all very helpful.
All right. Well, tomorrow, a little bit of information from Dr. Alan Greiner, the Chief Medical Officer for the Unified Government Public Health Department, and Johnson County Public Health Officer Dr. Joseph Lemaster will be here to update the spread of the virus in their counties. As we wrap up today, final thoughts, Dr. Alley?
Being Veterans Day, every single one of us loves to hear thank you, but sometimes we don't know how to respond to that. But to all of my fellow veterans out there, all we have to do is remember that it's we few, we happy few, we band of brothers.
Great. Justin, any final thoughts?
Man, it's hard to top that. I think, thank everyone for their support. As I said, Kansas City is an amazing community. We're very, very lucky to have you all, and thank you for allowing us to be part of all this.
Craig, anything you'd like to share as we wrap up?
No, just thanks for having me on. Check out the website, battlewithin.org, donate, sign up.
Dana?
I would just like to say, again, thank you to all the veterans making the ultimate sacrifice. My grandpa Joe was in the Pacific in World War II, and my grandpa Darrell was in Italy in World War II as well. John, I miss sitting with you and Lee at the Physicians Lounge, just listen to those stories. I know exactly what you're talking about. And Justin and Craig, thank you too both. Remember to stay healthy.
And I'll echo that, Justin, Craig, John, and really everyone who's a veteran in our community, and offer my personal thanks and the thanks of our collective health system for all you do and have done. As we wrap up today, we'll leave the final words to Dr. Stites. Be safe out there, wear your mask, and we'll see you tomorrow.
Now that there's a higher community transmission rate, your risk is higher because of that, and it tends to spread a lot more, and that's the nature of this disease. We're at a very delicate time. The proof is right here. It's at every hospital. And for anybody who doesn't believe it's true, I don't know how to help you. Where's the hottest zone, the hottest spot in any city in the country or in the world? It's right here in the hospital. It's right here where all our COVID patients are, because we group all those patients together. How many of our staff have gotten sick because they took care of a COVID patient? We think the answer is virtually none. It may be zero. Our staff get sick because they go out in the community. It's not because they're taking care of COVID patients. And why is that? Because they have to follow the rules of infection control. And putting a mask on works. this is my town, and I think that it's our town. And we have to do what we can to take care of each other and to bend the curve. And the way we keep each other safe is to do and follow the rules of infection control because they work. And if you don't believe it's true, you're just wrong. And you're putting the world at risk.